Okay, so this video is going to be a little bit different. If you guys have been following my channel for a while, you will have known that I was part of a 7-year BSMD program. So it's an accelerated combined bachelor's degree and medical degree program. And that's why I was able to get to med school at 21, or well, starting at 20. So I've told you guys there's a lot of different programs across the country. And one of the most popular ones and most unique ones is the one from UMKC, because it is 6 years. Yes, that is right. You go through undergrad in 2 years, so I've heard of people starting at literally 19, 18 years old in med school, which is kind of absurd. But one of the cool things we have today is we have a physician, an attending physician, who went through that program a while ago and wants to share her experiences and thoughts on how that impacted her life as a physician. So feel free to treat this like a podcast, put it on in the background. I don't know how long this interview is going to be, but for those of you interested in BSMD programs, and especially the UKMC program, or UMKC, I am so sorry, please stay tuned and enjoy.
Hey, editing Andy, just want to pop in and say, yeah, definitely treat this as a podcast. I made the mistake of using Microsoft Teams just because it's secure to do this meeting, and obviously not my usual standard for video. So you'll see like it kind of pops, pops in and out as far as like how the words and the mouths line up. But there's a lot of good information here that I think you'll enjoy. So just put on 2 times speed. You don't have to watch the video, but if you are interested in a BSMD program, especially the UMKC one, please watch. Okay, bye.
So you can flex yourself. You have the credentials.
Oh my goodness. Okay, well, can you hear me okay?
Yes.
Beautiful. Well, I'm Dr. Meryll Pampolina. I am an assistant professor of emergency medicine at the University of Arkansas for Medical Sciences in Little Rock. And then I also help teach a College of Medicine course to actually second-year medical students. And it's actually called the Practice of Medicine course. Yeah, that's a little bit about me. You're free to ask me more, but I'll just keep it there.
Sure. So did you mention what specialty?
Oh yeah, emergency medicine.
And how many years have you been practicing?
So I started as an attending in 2019. So this is my 3rd year.
Okay. And where did you match for residency?
At UAMS, so here in Little Rock, and I stayed on as an attending.
Okay, perfect. So I did a little bit in the introduction. So a lot of people on my channel know I came from a BSMD program, and like I've done a lot of advising for mine, as well as just a lot of people, since medicine is becoming so competitive as the years and years go on. These accelerated programs are becoming more and more popular. But I do have to warn people, like, each program is different. Everyone has their own different requirements. Everybody has their own structure, and it all just depends on if it's right for you. And so tell me a little bit about what makes the program you were in so unique.
Yeah, so I went to UMKC, or the University of Missouri, Kansas City, and it's their 6-year program. I know, so really fast. I think it's one of the fastest, or the fastest BSMD program in the United States. Why it's unique, I think it's because of how it was built from the ground up. So you, from year 1, pretty much day 1, get clinic exposure immediately. So I, as 17, 18, already was going to the clinics and going to the hospitals and starting to talk to people and interview people. And that progressed obviously throughout the whole 6 years. So I think that's one of the big unique things about my program that I really liked. And then obviously it's really fast. So it is a combo of your undergraduate and your, and your medical school training in the 6. So.
Okay, and actually, I did not know about the UMKC program until I watched a video of my good friend Josh Chen's channel, who he interviewed, I believe, a M1, well, she's in my class, a student who went through the program as well. And so before we touch on kind of the med school side of things, can you further explain how doing 4 years of undergrad in 2 years is even humanly possible.
Yeah, so things may have changed a little bit since I graduated, because I graduated in 2010. So that's already, oh my gosh. No, 2016. Oh my gosh. I graduated high school in 2010. But I graduated the med school in 2016. But pretty much your first 2 years are mostly undergrad courses. And so that's where you get a big bulk of that done. And then I believe in your fourth year of the program, you have like a semester or so to complete that undergraduate course. So you have roughly 2.5 years or so to finish that part, yeah, of the program.
Okay. And were there any, did you have to take the MCAT?
No.
That's at first. No. Okay. So that's always an interesting question to ask, because I've heard like the Brown one completely waives the MCAT. I know the Penn State program, their MCAT requirement was like a 504, which is like very far below the mean of like the entire country.
Mm-hmm.
So it's always interesting to hear different perspectives. Like, how did you think you missed out on anything not taking the MCAT?
No.
I think I knew the answer to that question before I asked it.
Yeah, no, I was very happy I did not have to take the MCAT. So.
Okay. And then you mentioned you do a lot of clinical stuff kind of like built into the curriculum. So with that on top of just your typical undergrad coursework, which I can imagine, I know for me, I was taking like 17, 18 credit hours a semester to finish my 4-year degree in 3 years. Like, how is the work-life balance in that?
So everybody's different, and everybody goes into the 6-year program differently. For me, I had a lot of credit coming in from high school. So I had a little bit less of a coursework than maybe some of my other colleagues. So for me, the work-life balance was fine. Typically the first 1 to 2 years, I think you do a clinic type rotation 1 to 2 times a week, depending on where we're rotating at. And it's usually like a half day or like 3 to 4 hours that you're there. And then the rest of the time was obviously your undergrad courses that you took. But like I said, for me, I came in with a lot of credit already. So it surprisingly was not as bad as I thought it would be. I know, that may not be the typical answer, but no, and I just background on that. I was a very busy child. Like I did gymnastics my entire life, so I already had to do a lot of work-life balance before I even started medical school. Yeah. So transitioning to the 6th year and like trying to balance those two things out wasn't as hard of a transition for me personally because of how busy I already was growing up.
Gotcha. No, I definitely feel that. I was the same way in high school. So like going into an accelerated program, I was already kind of used to the workload. So it definitely didn't feel as bad. So I want to talk a little bit more about the med school side of things, especially because I'm in medical school. I've transitioned technically out of the program now that I'm just like a medical student. And for those watching who wants to know a little bit more about like the undergrad piece of it, again, Josh Chen did a fantastic video talking more about that. But I want to hear more about your perspective in med school as part of this program. So me personally, I came into med school at 20 years old. And I have definitely felt many times where I was treated like a baby by peers and patients alike. I've had patients straight up tell me like, who is this 14-year-old coming into this room to see me?
Yeah.
I wish I was joking. So coming into medical school, how did you feel? Did you feel underprepared at all? You know, first you can talk about academics. Did you feel kind of behind in that regard? But then socially, did you feel kind of like you weren't able to relate to the other people in your class just because age?
So remind me, how does your transition work from, like, how does your BSMD program work?
So it's just a condensed 3 years, and then you have to fulfill a GPA and MCAT requirement,
Mm-hmm.
as well as like a small interview and some clinical volunteer hours before like a certain date. And as long
Mm-hmm.
as you check all those boxes, you're good. And you just go on through to medical school and you join that class just like a normal student.
Okay, so is it that you join like the traditional route students?
Yeah, so we're in it
Okay.
with everybody.
Okay. So UMKC maybe it's a little different. So for us, like there's the core group of us are in the 6 year program, and then we have traditional students join us, so that's probably like 20 or so. So
Huh.
that all being said, I never felt younger or unprepared because everybody who joined the program from year one was my age or maybe slightly younger. So we were all the same age going into the med school component, and then we had the traditional med school students join us as well. So then that's when we had that group.
Yeah.
But in terms of not feeling prepared or mature academically or emotionally, I because everybody was my age throughout med school, it never felt like I was a baby, if that makes sense.
So correct me if I'm wrong, you still have like your cohort that went in with the traditional students, but did you guys not get mixed in with everybody else? Did you stay within your cohort once you got to the med school component?
So yeah, so we got mixed. How do I say this? So let's say there's like 120 that started that are like the 6 year program, and so we just yeah, exactly. So the
Whoa,
program
wait.
itself,
Oh,
yeah,
okay. Okay, now
yeah,
that's what I did not know. So that's
yeah,
interesting. My cohort was like 19 people.
yeah. So the
So
whole
that's where I'm confused.
yeah,
Gotcha.
so the whole program is based off of the 6 years. So my class was like made up of 120 or so people. And then once we got to the med school traditional part, then there's like 20 or so traditional that join our crop of students. So it's kind of like a reverse.
Gotcha. Okay, that's really good to know because
Yeah.
that changes a lot. Wow.
Yeah.
So, huh? That's insane. So does that mean like when like you're applying to this program, it's 120 spots that you're going after, not like for us, it's 120, 150 people fighting for less than 20 spots.
Oh yeah,
See what I mean?
no. They're filling those 120 spots from people from high school.
Whoa.
Mhm. Like
Okay.
it's like you're applying to the program like you're applying to college, but you're applying to med school.
Yeah,
Yeah.
I just didn't realize there were that many spots.
Hmm.
So I guess like you said, that definitely alleviates some of the like social pressures and everything. Because I mean, speaking from my own experience, my peers are all at the very least like 24, 25 years old. They've taken
Hmm.
multiple gap years and they've had some of them had full on careers as EMTs, nurse aides, and stuff like that before ever coming into med school. So there's a
Hmm.
lot of things that for them are just instinctual as far as like protocols, codes, and stuff like that. Where I'm going, what is what is the name of that drug again? Because
Yeah.
it's new. It's new
Yeah.
to me, and so I felt a lot of pressure just to almost play catch up at
Hmm.
times. Whereas a structure like how your program has it set up, I see a lot of social benefit to that.
Oh yeah. I mean, it was literally like you joined this exclusive group right from the start. So you were literally a family going through this really quick program together. You're all babies. I mean, compared to everybody, on the traditional 4 year track, and you all know that you're like you literally bond with these people as you go through this whole program. It's really
Yeah.
fun. I loved it.
And so switching around then, what did the like other 20, I guess traditional people think about you guys? Because I know, again, just kind of a compare and contrast my experience. There's definitely been some negative connotation to people from our program going into into the like general pool, because they can spot you from a mile away just because you're so young. And then a lot of people kind of make the program their personality, and not many people like that coming off. So how did the traditional applicant, traditional med student react to having, literally being outnumbered by you guys?
I hope they liked it. I mean, I don't know per se. I know that we all got along well. I mean, the president of my class, once we joined med school, ended up being a traditional track student. And a lot of the leaders in our class ended up being a traditional track student. So I think I would imagine that it's probably a little different than going into, a class of however big a traditional 4-year track is, because you are joining people who are quite younger than you. But in terms of like there being awkwardness or whatever outside of that, at least from what I remember, I think there was none of that after the initial point of getting to know each other.
That's so good to hear. And especially for people like with that fear of going into the program, I think that comes a lot of anxieties. Okay, so well that covers kind of your experience in med school.
Yeah.
Now, we have a unique perspective of somebody who went through the program and is now like a full attending physician. And so think back to when you first left med school. You're a fresh intern resident. How did your patients react to you being that young?
So when you sent me this question, I was trying to figure out how to answer it, because I think I don't go into patient rooms and introduce myself as, "Hi, I'm Dr. Pampolina. I'm 23 years old."
Yeah.
As an intern. So I don't think many of them knew that I was younger than my colleagues, at least by knowing my age to begin with, if that makes sense. I think there's a lot of things that play a part into maybe how patients may interact with me outside of my age. Meaning, I'm younger, I'm a female, I'm smaller than my male colleagues, that type of stuff. So I think that plays a part with how, in addition to my age, does that make sense? In terms of like how they interact with me. So like day one intern year, I would like to think that they didn't treat me any differently than they treated the rest of my co-interns, because they didn't know. I would like to think that the good thing that I loved about UMKC is that program prepared me so well for intern year. Like I felt like I was ready to go. So in terms of managing patients and taking care of them from that standpoint, I felt like I was pretty mature and had a good amount of experience there. So I don't think that they treated me any differently purely because of my age. Because now, if that would be the case, I would be treated a little differently, right? Because I'm a little bit more mature, I'm a little bit older, but I still have some of those experiences now. So it's a complicated question and it's a complicated answer, and I could go on and on about this, but I think I don't think they treated me any differently based on that alone.
Okay. Yeah, I understand. There's many layers to that question for sure. And I wanted to ask that question honestly from a personal standpoint, because I told you I've had experiences where of course I'm a medical student now and I haven't like seen patients solely by myself yet before hitting clinical rotations. So most of the times I see patients, I'm with a resident, and so you'll see like the attending and then the resident and then me. And so you can see the patient's eyes kind of like go down the hierarchy and then land on me and go, "Who are you?" And that's always such a fear of mine. When I hit clerkships, because I don't know how patients are going to react, just because baby face, I guess, for lack of a better word. There's always that fear where you want your patients to trust you.
And I think this gets really tough. We're gonna get real deep for a second. I don't think it's not. I'm not going to tell you when you graduate or when you leave or when you move on that you're not going to encounter that, because you probably are, and I think a lot of us do. I think something that's really helped me is to embrace the fact that I am just as well trained as the rest of my colleagues, no matter how old or whoever they are, and I have the same credentials as my colleagues by the time I graduate, right? And I think for us, let's say for us who encounter that, to put that added weight of trying to, how do I say this? Deal with or anticipate or bear with the fact that we're worried that someone's going to treat us any differently, that's us kind of skipping a couple steps, right? And I always bring myself back to the fact that I am just as knowledgeable, I'm just as trained, I have the same credentials as everybody else. It's a normal worry to encounter, especially for us who are coming in from quicker programs. But I just keep reassuring myself and telling myself that I still know just as much as everybody else. It'll be okay.
Yeah, really good words of advice. Some that I definitely needed to hear. Well, I think while we're on the topic of age, did it impact your experience going through the match process when you were applying to residency programs? I know within your medical school that was the norm, but compared to different programs like mine, where I'm the minority, and then expand that to the entire country, where most of your applicants do have a pretty large background in medicine outside of med school, simply because they've been alive longer than you. How did you feel, competitive wise, you were in the match process?
I'd like to think I was a competitive applicant. I think people will know when you come from an accelerated program, and I'm sure that there's some who will weigh that differently than others do. I think in the end, though, they obviously want to see like what you did with your time in medical school, right? Like outside of the age, what else makes you a competitive applicant whenever you apply to their program? And as long as you have that, or at least that's how I felt going in, then I mean, like I said, I didn't feel like it played as big of a part. At least I don't think. I haven't asked these other programs, but I don't think it played a part for me whenever I was applying to emergency medicine.
Okay, and that's just a question I've also been asked too, where the students pursuing these programs, they're thinking years and years into the future. It's like, does that lessen your competitiveness? So good to know that.
Yeah. I mean, and to be honest, there's several from UMKC that's gotten to like very, very, very competitive programs, right? Even if they're younger. And it's because of what they did while they were in medical school,
right,
that they could put on their applications, on their CVs, on ERAS, on VC, on all of these things that made them appeal to these places.
Good advice. All right, so next question. What did you appreciate the most about going through like the undergrad and medical school process so quickly?
I loved it. Okay. I love that it was fast. To be honest, I keep talking to all my friends about this. I'm like, if I had the chance to do this again, I would do this program again. And it's because I already kind of mentioned this earlier. I was a pretty busy kid growing up. I didn't have much time to quote waste time. So the 6-year program was perfect for me. I loved how it was very to the point. It was very high yield. And then obviously all of that clinic exposure and patient encounters, loved. None of my colleagues here went to a 6-year program. So, they all went to the traditional 4 and 4 and maybe took a gap year in between. I don't know how I personally would have done with that. Like, I think I would have been fine with the 4 years. I hope I would have gotten past the other side, gotten into med school. But I loved how fast the 6-year program was. Like, I don't know if I would have benefited too much from an additional 2 years.
Okay. And I guess like kind of to elaborate on that, what
Hmm.
are some of the advantages of going through that quick? Just to highlight a few.
Um, for me, it was once again like the efficiency of going in that quick. For the UMKC program, I did not have to take an MCAT. So that's another great thing about UMKC. Um, and once again, I really loved the program not because of the 6 years, but because of how they used the 6 years, if that makes sense. Um, and once I keep harping on this, but it's because I am the clinician I am today because of my experience at that med school. And it's because of how they built, for me, how they built that patient encounters, clinic exposures, hands-on experience. That is really what made UMKC the program for me. Like I learned so much through that time with how they built it that once again, I do it over again. And again.
That is awesome. Well, I guess like that leads us to the last question I have, and it sounds like you've answered it again and again throughout the interview. If you were to go back, would you have changed anything about the path that got you to where you are today? And it sounds like we know the answer.
Yeah, nope, wouldn't change anything at all. I love that program. I have a lot of once again, a lot of me is who I am today because of them. So shout out to anybody listening from UMKC. I seriously am so grateful.
Sponsored by UMKC. Oh my gosh.
Yeah, no, I loved it. So
That is awesome. Well, is there anything else you think would be important to tell a prospective student, in high school, 17 to 18-year-olds? We got new seniors coming up this next year who may be interested in applying to this program. Do you have anything to tell them right now?
yeah, I think in the end, regardless of what you end up doing, making sure that if you do go into medicine, that you're doing it because you want to do it. Not because anyone else is telling you to do it, not because you're feeling pressure to do it, but because you want to go into medicine and you want to be a physician and treat patients and take care of them. Especially for these accelerated programs, and especially for UMKC, like you are committing as an 18-year-old to go to medical school. So you really want to make sure that you are doing this for you and because of the person that you want to be. That's my big advice.
Oh, that's so good because a lot of the advice I give to people wanting to go into my program is the exact same. Like, as a 17 to 18-year-old, are you committed to medicine? And if the answer is not 100% yes, it is a no. So, good to know that that advice holds true across different programs. Well, thank you so much, Meryl. I'm gonna let you go at least for this recording.
That's
We
good.
can talk. We can talk a little bit afterwards, but as far as the video goes, thank you so much.
You're welcome.
Say hi to the audience and my subscribers, and who knows, might have a couple future physicians going through your program, and might be working under you someday.
Oh, that'd be super exciting. Well, thank you for having me.